Guys, the topic here that I'll be touching on is your cognitive learning theory. So this is part of the theories that we are discussing as part of your nursing informatics course. So in your cognitive learning theory that says that learning usually meant to think using the brain. And it implies the different processes concerning learning, which can be explained by analyzing the mental processes first. Now, diba, if you would look at the term cognitive, we usually use the term cognitive interchangeably with the term knowledge. Diba, when we say cognitive, we usually look into knowledge. So, plus in cognitive learning theory, your cognitive learning theory tells us that learning class is part of our mental processes. Okay? Kung kaya nga cognitive, no? Because it's looking into the mental processes. That's your keyword there. Now, plus when we talk about your cognitive theory, it usually separates it into two. No? There are two. If I'm not mistaken, you have your, let me see. So there are two theories there that are considered to be part of your cognitive learning theories. One is your, okay, I'm picking up the words. So, plus basically, your cognitive learning theory reminds you that if there's a problem on the mental processes of an individual, okay, that individual is not able to learn properly. Okay, that's one of the tenets of your cognitive learning theory. Now, the two specific theories under your cognitive learning theory, my dear students, are your SCT and then your CBT. So you have your social cognitive theory, and then another one class is your cognitive behavioral theory. So social cognitive theory and then your cognitive behavioral theory. Now, let's talk about your social cognitive theory. According to your social cognitive theory, there are three variables that could affect the cognition of an individual. One class is your behavioral factors. The other one is your environmental factors or your extrinsic. And then another one is your intrinsic, which are your personal factors. Now, can anybody give me an example of the environmental factors that are being mentioned here? Give me an example of an environmental factor that is being considered to be part of your social cognitive theory. Yes? Anybody? Give me an example of an environmental factor.
Family and friends, sir.
Family and friends? What else? Sige, family and friends.
Observational learning, sir.
Observational learning also. What else? Sige, others. I would want to hear others also talk about it. Give me other examples of environmental factors that could possibly affect the learning process of an individual. Yes?
Food, sir.
Again?
Food.
Sorry, Nico, I cannot hear. What's that?
Food, sir.
Again?
Food.
Food. Okay, I think I need food. Okay, so your food products. Okay, thank you for that. How about for personal factors? What are considered class to be personal factors that affects the learning of the individuals? Sige, an example?
Motivation of an individual, sir.
Okay, the motivation of the individual is one example. Now, class, if you would look at the social cognitive theory, I think it's also illustrated in your book. It would show to us, class, the interrelationship between your behavior, between your personal factors, and then your environmental factors. Our classmate earlier mentioned that one of the environmental factors now is the friends, the family and the friends. Okay? Yes, class, your family and friends may be considered an environmental factor because they are outside of that specific individual of your concern. Now, class, that simply reminds us that the family and friends of our patients usually affect how they also learn and how they also react with the environment. Now, for example, if I'm talking about problematic students, if I'm talking about students who are unable to focus class on their classes, usually they would have problems related to their family. Okay, so sometimes class they have problems wherein they are not talking to you. But then class, if you will talk to them and try to determine, the problem pala is arising from their families. Okay? Now, another example or maybe a simpler example of your environment is the climate that we have. Okay? Picture yourselves if it's very hot right now in your environment, if you're not using an air conditioning unit, it's very hot. The tendency is that you are unable to focus. And then the tendency is that your behavior is that you'll become irritable. Okay? That's one thing. Or another thing, for example, stressful environment. Picture out that you're having, for example, your online classes, and then the environment that's surrounding you is very noisy. Okay? For example, you have a baby brother that's very noisy. You have your mother's very noisy. You have your parents who are always quarreling there, maybe. And then you have construction workers, maybe as an example. So, plus you will feel that there's a lot of noise and you could not focus on the topics that are being discussed. That's an example of an environmental factor. Now, when you talk about personal factor, class, it's more of what's happening within our system. That's why, class, when you talk about personal factor, one of the examples there is your biological events. You would have your biological events other than the cognitive and then the affective. Now, class, what do we mean by biological events? For example, if you're dealing with a patient who is unable to focus, one thing that you might look into is what's the blood sugar levels of the patient? Because class, your patient may have decreased blood sugar levels. Pag decrease yung blood sugar levels mo, biologically, your body does not have the glucose supply class for you to take, no, or for you to function properly. So those are example. Affective naman. Pag sinabi kong affective, what's one word for that? What's a synonymous word that starts also with letter A? Pag sinabi kong affective, give me one word that is also synonymous to your affective. Yes, yes? Anybody? Sige na guys. Affective. A, letter T. What's that word? When I talk about affective.
Attitude, sir.
Okay? Plus, you're also referring to the attitude of the individual. Okay? So those are considered to be personal factors. And these factors, class, play hand in hand in order for behavior to occur. Now, your classmate earlier has mentioned about observational learning. And class, your observational learning is one of the main tenets or one maybe of the main examples under class your social cognitive theory. Class, when we talk about observational learning, as discussed class, or as the term implies, pag sinabi ko class observation, you observe, di ba? So class, you learn. You learn from other people by observing them in an effective way of gaining knowledge and altering behavior. So what do we mean class by observational learning? Pag titingnan po natin, for example, I'm your instructor in nursing, and then I'm demonstrating the procedure in front of you. And then you're trying to mimic the procedure, you're trying to do it properly as well, or you're trying to copy how I do it. That is observational learning. Or for example, if we are working in the hospital, halimbawa ako yung senior nurse mo, tapos itong si Bernice, si Lori, you are new nurses, for example. So, what would you do? Your tendency is that to observe me. Okay? You will try to observe me and then try to find out if what am I doing in order to address the concerns of the patient. That is what also being referred to as observational learning. Okay, so learning from other people by means of observing. And when I use class the term reproduction, it is the process wherein the aim class is to effectively increase the repetition of behavior by putting the individual in a comfortable environment with readily accessible materials. Now, class, ano pong ibig sabihin here ng reproduction? Di ba, class, when I talk about reproduction, siguro oftentimes pumapasok sa isip natin sexual reproduction. But in this case, class, your reproduction is more of replication. So, class, reproduction would mean replication. Kumbaga, class, we are trying to encourage the individual to reproduce the effort. We are trying to encourage the individual to replicate what he has done. And we are doing that, class, by making the environment comfortable. Okay? So for example, if I would want you to listen to my class, maybe what I'm doing is that if you are, for example, kindergarten students or elementary students, I need to ensure that there are some materials that you can enjoy inside the classroom, that our classroom is not very hot, and that our classroom would contain all the things that would make you interact. Okay, so I try to make the materials readily accessible to you as my pupils, as an example, so that you will be able to repeat that behavior over and over again. Now, for example, if we're talking about our patients, no, okay, class, let's picture a patient with stroke. Pag sinabi ko, class, na yung patient natin may stroke, isang common manifestation po ng stroke is that you would have your hemiplegia, okay, or you would have your hemiparesis. Class, in hemiparesis, as the term implies hemi, ibig sabihin class one side of the body, okay, one side class of the body would have weakness, okay? One side class of the body would have body weakness, okay? Now class, when we talk about that body weakness in your hemiparesis, ano po yung nangyayari kay patient, no? So usually class, we are scheduling our patient for rehabilitation. We are scheduling our patient for rehabilitation. So, if I will schedule class my patient who had stroke for rehabilitation, okay? Now, papakitaan ko kayo ng pictures. One thing class that we do is that we make sure that the environment where the rehab will be done will be safe. Okay, class, the environment where the rehab will be done will be also safe. Now, look at this class. Oh. Kung nakikita ninyo, may mga railings siyang hinahawakan. Doon sa likod class, parang nagmimimik yan ng stairs so that the patient will be able to practice to climb up the stairs and to go down the stairs safely. Okay? So class, in rehabilitation, our goal is to make the environment safe for our patient because we would want him to continue the behavior. We would want him to have his senses go back to normal. Gusto natin class na bumalik yung left-sided weakness niya, baka po mag-normal, or para mas strengthen natin yung extremities ng patient natin. So class, we are doing it to make the materials readily accessible to them. Because class, we aim for self-efficacy. So class, when we talk about self-efficacy, the learner improves newly learned knowledge or behavior by putting it into practice. Okay? Because class, take note we are learning here about learning. So when we talk about social cognitive theory, your goal is that you put it into practice. Hindi pwede class that, for example, you're just learning it, you will have just the knowledge, and then you have the attitude. That knowledge and attitude class needs to be converted to your skills. And that can only be attained by constant practice. Okay? So class, it needs to be put into practice. So one example perhaps is that insulin injections. For example, if you have your insulin injections, plus when we talk about insulin injections, what type of patient needs this? What type of patient needs this? What are their disease process? Sino po yung kailangan ng insulin?
Diabetic, sir.
Okay, so your patient to have diabetes. Okay? Now, you will know later on in MS that not all patients with diabetes need it. But okay, insulin is given among patients with diabetes. So class, one of the management is insulin. And when we talk about insulin, we usually educate your patients to do your self-injection. So what would you do? No? You educate first your patient. You tell your patient, this is your insulin. This is how to mix your insulin. So you narrate the purpose. And then you narrate the purpose and then the procedure that will be involved on your insulin. Okay? Then after that class, we deal with the attitude of the patient. So we tell your patient that this is the right attitude when we're dealing with diabetes. And then later on, your goal is that your patient would practice injecting to themselves alone. Okay, so your patient's class would practice self-injection. Okay? Now, class, if your patient would not be able to put it into practice, for example, nag-demo-demo lang kayo, pagkatapos hindi niya naman na-practice, is self-efficacy attained? Is self-efficacy attained? Kung hindi niya na-practice on his own. Okay? So, class, self-efficacy would not be attained. Okay? Now, why am I giving you that as an example? There are patients whom we are educating. In-educate mo, sir, ganito po yun. Ganito po mag-inject ng insulin. Ganito po maglinis ng abdomen natin. But plus, by the time that they will go home, the tendency is that they would rely still to their family members as to how to do it. So there is no self-efficacy there. So as a nurse, you need to reinforce na naman your patients. Okay? Now, emotional coping. When we look at the term class emotional coping, this refers to good coping mechanisms against stress and negative personal characteristics. So class, look at the definition. This is very much applicable to your lives also. So class, when we talk about coping class should be against stress and then also negative personal characteristics. Now, it goes without saying. No, I don't know if you've heard of a quote which says that you cannot change how others react, but you can surely change how you react to the situation. Okay? Now, as a nurse, you are being frequently reminded of that. For example, yung pasyente mo is a psychiatric patient and then bigla ka na lang sinampal ng pasyente mo. Okay? Imagine it's a very good day. You said, "Good morning, ma'am. Good morning, sir." Pagkatapos class, bigla ka na lang sinampal out of the blue. What would you feel, di ba? You would feel bad, no? Kasi nga yung ganda-ganda pa ng makeup mo, halimbawa, pagkatapos bigla ka na lang sinampal for today's video. So what would you feel? You'll actually feel bad about that. But then class, we need to remember that it's the patient's reaction towards you. Okay? Kung baga class, hindi niya alam, bigla lang siya nagalit or baka sino po yung naalala niya, tapos ikaw yung nearby, tapos sinampal ka. But the way you react, for example, pag nasira yung buong araw mo because of that, that's already up to you. That's not already up to the patient. So you need to remember that when we talk about emotional coping, you should be able to deal with stress and negative personal characteristics. And when we talk about plus dealing with stress is not escaping stress. Okay? Plus when we talk about coping mechanisms against stress, it is coping against it but not avoiding it. Okay? Now, paano naman sir kung ang pasyente ko ina-avoid? Di ba class, no? Kahit tayo, di ba? Paminsan-minsan, there are instances, for example, if we are stressed, what's the tendency? We will tell ourselves, hayaan mo yan, wala akong pakialam. Okay? Now class, that's not coping, that's avoiding stress. Pero class, pag ganun yung sasabihin ng patient mo, what would you do? You do not force class your patient to address the stress right away. Okay, for example, sabihin niya, "Ay, nurse, wala akong pakialam dyan. Okay, hayaan mo lang yan. That's not stress to me." That's not stress, pero stress siya. No? Okay, so class, ano po yung gagawin mo? Just let the patient be, and then class, remind the patient later on as to how to deal with it. Huwag mong pilitin right there and then kasi sasabog po yung patient nyo. Okay, in your terms na magbe-breakdown kayo kapag pipilitin. In the same way, class, negative personal characteristics. You could not deny that there will always be negative personal characteristics. Okay, hindi nyo po yan madi-deny. Ha? Kumbaga pa kung mga friends nyo sasabihin sa inyo na okay lang, hindi lahat ng tao magkakagusto sa iyo. Ay para mga ganong drama ng buhay, ano? Which is actually true, class, no? So when we talk about negative personal characteristics, picture people wherein it's a very happy day and then they will talk about negative things, no? For example, you're talking about success, you're talking about party, and then suddenly, class, he will insert topic na alam mo, maraming namamatay sa party. Alam mo, maraming namamatay sa kakatawa. Na yun yung para mga KJ. Now, class, don't right away react to it, no? And please, as a nurse, understand that they are actually going through something. They are actually going through something. Ito po yung usual dictum na sinasabi namin about patients. Pag galit po yung pasyente sa inyo, pag galit po yung isang tao sa inyo, it's not usually, class, that they have a problem with you, but they have a problem with themselves. They have a problem with themselves. And they need to recognize that problem for them to be able to address it. Now, self-regulatory capability. What do you mean, class, by self-regulatory capability? When I say, class, self-regulatory capability, that's the ability to control behavior even in unfavorable environment. Okay? So ano pong ibig sabihin natin? For example, kahit sinampal ka, ikaw bilang nurse, alam mo na nurse ka. He's going through something as a patient. Hindi mo siya papatulan. That's your self-regulatory capability. Or for example, ang init-init, what are you doing? You will try to drink water because you would want to calm yourself. That is also a self-regulatory capability. Your ability to control your behavior even in unfavorable environment. And class, sabi daw nila, that's the greatest mastery daw, ano? na kahit galit ka, alam mo kung paano mo pipigilan yung galit mo if it is not yet time for you to release your anger. Okay? Now, take note class yung sinabi ko if it is not yet time to release your anger. Now, for example, regarding that example about a patient na sinampal ka. Class, kapag sinampal ka ng patient, yes, kay normal lang po na magagalit kayo, normal lang po na mag-frustrate kayo. But do not, wag niyo pong iganti sa pasyente ninyo. Because by the time class na susuntukin mo rin yung pasyente mo, ikaw yung mawawalan ng license. Sir, paano na lang yung galit ko? Plus, ilabas mo later on. Kapag may punching bag sa hospital nyo, i-punching bag mo sa hospital. Ang usual pong nire-recommend ng mga psychologists is that you go outside in an open space and then shout. Okay? Plus, if you are angry, it does not mean that you need to deny the feelings. Kasi plus, the more that you would deny it, the more that you would explode easily. The more that you would explode easily. Have you noticed that? Na kapag galit na galit ka tapos hindi mo na ilalabas, parang yung feeling mo makakapatay ka ng tao, di ba? Okay, so class, in the same way, we educate our patients on that. So that is for your social cognitive theory. The next one, class, is your cognitive behavioral theory. Plus, for your cognitive behavioral theory, it describes the role of cognition. Okay, it describes, class, the role of cognition in determining the behavioral pattern of an individual. Again, plus, it describes the role of cognition in determining the behavioral pattern of an individual. Okay, wait lang. Pattern of an individual. And again, when we talk about cognition, as emphasized there in your books, your cognition class would be equivalent to the term knowing. Okay, this one is developed by Aaron. Okay, it's developed by Aaron Beck, your cognitive behavioral theory. Now, what is the assumptions of your cognitive behavioral theory? Your cognitive behavioral theory tells us that an individual tend to form self-concepts that affect the behavior they display. These concepts can be positive, negative, and can be affected by a person's environment. So what do we mean by that now? So for example, if we're talking about, let's say for example, we're talking about a beauty contest. Okay, we're discussing beauty contest among our patients. Class, beauty contest may be seen by many as something fun. Beauty contest class may be seen by many as something that we need to look forward for. But your patients may able to formulate concepts regarding that. And their concept class could either be positive, it could also be negative. Okay? Now, if for you as a nurse, this is a positive experience kasi nga you enjoy beauty contest, sabay kayo halimbawa ng boyfriend mo, nanonood ng beauty contest, plus please do not expect that your patients would view it positively all the time. It may be possible also that your patients would be viewing it negatively. And plus, that concept that your patient has undergone or that concept that your patient formulated will be the one that would actually lead to their behavior. Okay? Now, why are we learning cognitive behavioral theory? Because your cognitive behavioral theory may be able to explain why your patient are acting like this and why your patient is acting like that. It's because of what they think. Okay, it's because of what they think. Okay, now take note that these can be affected positively, class, or negatively by the person's environment. So, depende sa environment, Plus, a very common example in psychiatry or psychology is that when you deal with abusive patients, okay, when you deal with patients who had abuse, plus ano po yung nangyayari among abusive patients? In the past, class, if you would look at their history, one of the very big possibilities is that they were also victims of abuse or they have also observed abuse in their household. So halimbawa, pag sinasaktan niyo yung asawa, tapos pumunta sila class sa ER, later you will know na yung asawa pala class or yung husband pala na nananakit, dati-rate yung mga parents niya, ganun rin. Nakikita niya, akala niya okay lang nasaktan yung asawa niya, akala niya okay lang nasisigawan yung asawa niya, akala niya class okay lang na ganun yung mangyari. Okay, so they tend to enter abusive relationships because they have also observed abuse in the past. Okay, so that's one why we are having your cognitive behavioral theory. What else nga ba? When you're talking about Okay? For example, since we're talking about nursing informatics, in a particular unit class, no? In a particular unit, uh, sorry. For example, mag-i-implement tayo ng change in a system. There is a tendency, dear students, that if a lot of old nurses in that nursing unit does not agree to the change, yung mga junior nurses po, ganun din po yung mafe-feel. Okay? Kasi nga po nai-influence po sila ng mga senior nurses nila as to how they think. Okay? So basically, the things here that we are looking into the cognitive behavioral theory is that about your thoughts, about your feelings, and also about your behavior. So class, your cognitive behavioral theory tells us that whatever you think of will be translated towards your behavior. Okay? So that's why, if hindi po natin gusto yung behavior ng pasyente natin, we educate them. We tell them. We let them know. Okay? Halimbawa, sa psych, kapag may pasyente, this happens hindi lang nga to sa psych, this happens to us even in the emergency room setting. Now, class, for example, mga parents na nagwa-wild. Halimbawa, class, may parents sa ER. Galit na galit kasi yung bata nagkaka-fever, tapos daw hindi na a-attend ng nurse. Yung fever po ng anak niya is 4 hours ago nag-start. Okay, the fever of the child started 4 hours ago. And then class, picture the situation na may stroke ka, may patient ka na may chest pain. So kahit po una pang umabot yung patient na may fever sa ER, uunahin pa rin po yung may chest pain at saka may stroke. Kasi in the ER, we are not on the first come, first serve basis, di ba? If you have recalled in your fundamentals of nursing, you are introduced to the term triage, which means, class, that we prioritize patients based on their needs. No? We prioritize patients based on their needs. Now, class, here comes this mother during my ER duty. And then, class, the mother, class, was shouting in the ER. Why is that her child was not given due care daw? And then when I asked the mother, class, the mother is narrated that the fever of the child started 4 hours ago. So what do I have to do as a nurse? You need to inform the mother, ma'am, please, wag lang pong sisigaw sa ER. Okay? Or ma'am, please, we do not tolerate shouting here in the ER. Okay? And then explain lang sa kanya, ma'am, there are other patients that are also anxious. Pagkatapos, class, pag tuloy-tuloy pa rin yung pagsigaw, sasabihan lang, ma'am, I will be calling the security guard if you will go on. Okay? Ganun lang, class, no? Okay? Huwag niyo po siyang tinethreaten, pero class, you're just stating the fact. And then you educate them. Ma'am, the fever of your child started 4 hours ago. As of this time, it's not considered an emergency. If you are able to wait, you will be attended by our doctors and nurses later on. Okay? Plus, you're teaching them, you're telling them what's the right thing as of this time so that they will also keep calm. Now, isipin nyo naman, if you are on the foot of that mother may have had experienced fever for her child the first time. Okay, baka first time nyo po ma-experience ang fever sa bata niya. Okay, so class, it's natural only that that mother would feel anxious. It's just natural, class, that that mother would feel outrageous about that condition that her patient had. Okay, so wag yung i-judge na okay, so wag yung i-judge yung mother na itong mother panic attack o itong mother masyado namang anxious. Okay, so just educate them as to how it to do properly. Okay. So class, the next theory or model that we will be touching on is your novice to expert model. If you can recall, maybe this is one of the models that you have discussed in theoretical foundations of nursing that you find to be easily to understand. So class, your novice to expert model. Novice to expert model, class, is actually that of Dreyfus, no? Class, this is actually the work of the Dreyfus, this class, the work of your Dreyfus brothers, and later on, class, was adopted by our own nursing theories, your Patricia Benner. So class, Patricia Benner adopted this theory and applied this in the nursing practice. So if you would look at, class, the Dreyfus model, your Dreyfus model is actually talking about the model of skill acquisition by Hubert and Stuart Dreyfus. So they are your Dreyfus brothers. Kung kaya, class, the theory is referred to Dreyfus brothers kasi silang magkapatid yung gumawa niyan initially. And then later on, class, adopted by Patricia Benner. Now, if I would look at novice to expert model class, for you to easily memorize that, you need to memorize it as NACPE. Novice, advanced beginner, then you have class your competent, you have your proficient, and then you also have your expert. Okay, so class, according to this model, anybody who is in a profession or anybody who is doing work will progress class from the novice to the expert level once they are already in their work. Now, one thing that you need to remember is that by the time that you would start your work, you will become a novice. And then class, after several years or after the anong tawag natin dyan, after you have acquired some skills, you would become an advanced beginner, and then plus you would become competent, you would become proficient, and you would become an expert. Plus, usually when I say expert, in the model of Benner, we would usually equate it to about 10 years of experience. Now, let's picture this question. For example, class, if you are a nurse assigned in the emergency room for about 10 years, and then you already have the intuitive grasp class, can you be considered an expert? You are an emergency room for 10 years. Tapos class, parang may clinical eye ka na, alam mo na kaagad kung anong gagawin sa isang patient. Pagkatapos class, parang may intuition ka. Intuition class, parang sinasabi mo na lang sa self mo na, feeling ko may appendicitis yan. Alam ko, feeling ko malala yung pakiramdam yan. Can that nurse be considered an expert?
Yes, sir.
Yes, sir.
Based on the NACPE model, yes, the nurse could be considered an expert. Now, let's say, for example, this same nurse, my dear students, transferred to the neonatal ICU. So when I say neonatal ICU, that's the unit that takes care of your babies, no? That's the unit that takes care of your babies or particularly your newborns. Now, in that case, guys, if itong nurse na to nag-transfer class sa neonatal ICU, can the nurse be considered an expert in the neonatal ICU? Can the nurse be considered an expert in the neonatal ICU?
No, sir. Since nag-transfer siya, sir, from
Okay.
emergency to neonatal, I see.
Good capture. So class, the nurse is considered to be an expert in the ER, but in the neonatal ICU, that nurse is considered to be novice. The nurse is considered novice in the neonatal ICU. May mga halo-halo dyan sa picture nila. Okay? So class, that's one of the message in your NACPE model. Now, what's the application of this theory? Class, the development of nursing informatics skills, competencies, and expertise in nursing informatics specialists. So what do I mean by that? Class, by the time that you started, you are considered to be a beginner in nurse informatics. Okay, you are not to be considered an expert in nurse informatics because you don't have yet the experience that is focused on nursing informatics. Then class, when we develop technological system competencies in practicing nurses working in an institution. So class, in my discussion, I have mentioned that in some hospitals, there is what we refer to as your super users. So class, usually your super users would belong on the CP&E. Plus, your super users would usually belong on the CP&E, competent, proficient, and expert. Hindi po pwedeng tawagin na super user ang isang novice. And then, class, if you have listened to the discussion, when I say super user, they are usually the person whom we refer to in case na nagka-problema tayo sa isang machine. Okay? In case, class, na may problema tayo sa isang machine, doon po tayo sa taong yan nagre-refer. No? In case may question po tayo sa isang machine. Okay? So that's your super user. Now, your education as student nurses from first year to graduation can also be based on your NACPE model. Plus, if you would look at your subjects in nursing, there is actually a reason why your theoretical foundations of nursing was discussed first. Okay, class, there is also plus a reason. Okay, class, there is also a reason bakit yung fundamentals of nursing discussed first. And the reason for that is that your fundamentals of nursing will be able to guide you in your future subjects. Okay? And your fundamentals in nursing skills, no? Your fundamentals in nursing skills could also be able to, anong tawag natin dyan, to reinforce the procedures that you will be doing when you will be third year and fourth year. So class, hindi pwede na third year ka, tapos you are learning about respiratory problems, pero wala kang idea ng suctioning. Because your suctioning is introduced to you by the time that you are first-year students in fundamentals of nursing. So, dear students, again, if you would look at it from first year to fourth year, your education is actually, we can say, ladderized in such a way that your skills in first year are actually vital to the second year. It will actually be vital going towards third year, and it will be very important when you go towards fourth year. Okay? So that's how we do it, no? So that's why kapag, for example, as of this time, you're having difficulty on your MCN, please try to focus on it because your maternal and child nursing concepts could actually also be applied once you are going towards level 3. Okay? Once you are going towards level 4, those are important. So plus that's also the same reason why we're having it. Then it's also your transition from being a graduate nurse to becoming an expert nurse. Now, itong usual na frustration na naririnig ko from my students. Once class you graduate, most of my students will say, hala sir, feeling ko ang bobo ko by the time I graduate. By the time I work in the hospital, feeling ko, sir, nakatunganga lang ako, hindi ko alam ang gagawin. Okay? You know what guys, parang nasa isip ko, expected. Okay? That's expected. Okay? Plus, because when you are in the hospitals, you will see nurses who are already expert in the fields. No? They're expert in the field. For example, if you're talking about an emergency room nurse na 10 years na, expert na po yan, may intuition na po yan, alam niya na po kung ano ang gagawin. Pero class, if you will be looking at nurses na parang fresh graduate, halimbawa kayo pag graduate nyo, yes class, tulalay pa kayo minsan, hindi nyo alam kung anong gagawin. Nakikita nyo yung patient nagka-cardiac arrest, pero yung pagmumukha nyo parang may halo. Okay? Parang hindi alam kung anong gagawin. Nagpapa-angel looks na lang. Okay? So may mga ganong nangyayari, class. And that is because you are still a novice and not an expert. Now, what are the distinguishing features of this theory now? There are two personal characteristics, class, that distinguish the successful evolution to the expert level. And what are those two characteristics? One, class, deliberate practice. And then pangalawa, the willingness to take risk and to go beyond the norm. Okay? Now, class, this is from a theory. This is not an advice from me, but you can actually hear me also saying this as an advice. One, class, look at that deliberate practice. Now, picture nurses. I have encountered a lot of nurses who would say, I don't know how to interpret ECG. Okay, there are nurses class who would say na hindi nila alam kung paano mag-interpret ng ECG. May nurses class na sasabihin ECG, mga linya, hindi ko alam kung anong gagawin dyan. But they are not practicing. Class, remember that nursing is a skill. Diba? Paulit-ulit nating sinasabi, nursing class is a skill. If you are not practicing your skill class, your skill would just fade away. But if you are practicing your skills class, your skills would lead towards expertise. Your skills class would lead towards expertise. Okay? And now look at that one, the willingness to take risk and to go beyond the norm. I forgot the leader who said this now, but the most dangerous place now, that leader mentioned now, that the most dangerous place now is your comfort zone. The most dangerous place is your comfort zone. Okay? Is one's comfort zone. Why? Comfort zone nga, tapos naging dangerous place pa. Ano? Okay? So class, bakit daw ganon? Kasi in your comfort zone, you don't tend to grow. In your comfort zone, you don't tend to grow. Okay? Now class, what do we mean by that? If you are within class your comfort zone, your tendency is that you will just do what you want. Okay? So, you just do what you want. Okay? In a while. Okay? So class, one thing that you need to know is, one thing that you need to do, for your class to become experts is that you should be willing to take risk. Okay? You should be willing to take risk. What do I mean by that now? And go beyond the norm. When I say go beyond the norm, usually, other nurses would say na, uy, wag na tayong mag-aral. Hindi po natin kailangang mag-aral. Pero class, kapag ikaw, you would want to go beyond that, you need to know that you need to engage yourself to training. Okay? And you need to go yourself, class, and you need to undergo several practices for you to become experts. Now, when we talk about deliberate practice, it is a trait shown by people who use a personal, goal-oriented approach to skill and knowledge development. And then, class, that personal, goal-oriented approach to skill and knowledge development is by devoting yourselves to engage in higher and ultimately expert performance. So take note trait po natin yan, tapos goal-oriented. Halimbawa, kung goal mo talaga na maging isang expert emergency room nurse, tuloy-tuloy i-practice mo. Pag gusto mo naman siya pag gusto mo naman for example na mag-become nurse practitioners, abroad class there are kasi nurse practitioners and there are also nurse anesthetists. So class, if you would want to become a nurse practitioner, if you would want to become a nurse anesthetist class, you need to continuously practice it. Okay, you need to continuously practice it. Okay? Now, this requires years of sustained effort to continually improve the quality of practice and performance within the skills. So, kay class, pag titingnan po natin, practice, performance, okay, what possibly happens is that, you need to be in that area for several years for you to become an expert. Ha? Hindi pwede class na, ay, bukas gusto ko maging expert ER nurse. Pagkagising mo, expert ka na kaagad. Okay? So those are some of the things now that needs to be considered. And when we talk about taking risk class is continuously climbing to the expert level not without the perceived risk enough. So it would require people to move beyond the status quo of mere competence through the level of proficiency, and that would be your expertise. Okay? Ano pong main point ng slide na to? Sinasabi niya lang na if you will go up the ladder, there will always be perceived risk. Okay? If you would want to become an expert, if you would want to go up the ladder of novice to expert, you would need to take risk. Class, in our degree, for example, in our profession, some of us are taking master's degree. Some of us, class, are taking doctoral degree, your PhD degree, your Doctor of Nursing Science. So it entails us additional expenses. It entails additional workload on our part to do that. Or other than that, class, you need to undergo additional training. You need to undergo additional exposure. No? You need to undergo additional exposure to several instances. So because of that, it allows you, dear students, to progress towards the ladder. And you are moving beyond the status quo. If I would go back to the quote earlier that I shared, your status quo would actually equate to the comfort zone that I mentioned earlier. If you just keep on doing what you're comfortable of, if you just keep on repeating what you are comfortable of, plus the tendency is that you will not grow. Okay? So the message of your NACPE model is that you should take risk. So class, when you progress occur, the person class would tend to move away from relying on rules and explicit knowledge. Pag novice ka kasi class, you do things because the rule says so. Okay? So class, the rules says so. The rules say that you need to go to, you need to do this, you need to do that. Yan yung basis ng isang nurse na considered to be novice. But when you become progressive, you don't rely on rules. Take note, I did not say na you do not follow rules. Ha? I just said that you do not rely on rules. Okay? Ibig sabihin, class, pag novice ka, sasabihin mo, ay dapat mag-take ako ng vital signs every 4 hours kasi the doctor's order says so. But if you are an expert, you know that even if the vital sign order is every 4 hours, you are taking the vital sign every 2 hours because you see your patient to be in a not good condition. So kahit iba yung order, alam mo that you will do this kasi ito yung kailangan ng pasyente ko. Again ha, I did not say you are not following rules, but I'm saying you are not dependent to the rules. Yan po yung characteristic ng isang pasyente or ng isang nurse on the expert. Then you also have better cognitive filtering. Now class, kayo, pag estudyante kayo, tendency is that pag may mga marites, parang madali pa kayo makikerry away. Okay? Halimbawa, sasabihan ka, uy, alam mo, itong pasyenteng to, may HIV to. So parang right away nakikerried away ka kasi HIV, bago mo lang narinig yan. Bago mo lang nakita yan. Gusto mong malaman kung totoo nga bang may HIV siya. But if you are becoming an expert, if you're going up the ladder, you can filter. Okay? You can filter what is actually true or not. Okay? Better cognitive filtering occurs. Now, picture an individual na palaging naniniwala sa mga marites. Diba? Can you think of somebody na palaging naniniwala sa mga marites? Okay? Plus, they're not actually considered experts. They're actually considered novices. Okay? Bakit po sila nabibiktima ng mga marites? Kasi wala po silang cognitive filtering Wala po silang cognitive filtering na tinatawag natin. Okay? So class, once you are become an expert, even though if I'll give you 100 data right now or 100 information right now, you know that out of the 100, you only need the 3. Okay? You only need the 3 and you know what are those 3 because you are already an expert. Okay? Plus, you are no longer confused by the collection of data, but instead, plus, you become a complete and unique whole where some bits are much more relevant than others. Then, plus, you also move from being a detached observer to the problem and you are becoming involved to the system itself. So, class, pag bagong nurse ka lang, alam mo ng tendency ng mga bagong nurses. Yung mga bagong nurses po actually is isa sa may pinakamaraming reklamo sa hospital. Okay? Bakit po? Natural lang yon kasi stress na, di ba? So, anong sinasabi ng nurse? Bakit ganito? Bakit natin gagawin yan? Bakit natin gagawin yan? According to the textbook, hindi dapat ganyan. Also, welcome to reality, kumbaga. And then, plus, by the time that you will become an expert, ano po yung tendency? You are the ones already involved in solving the problem. Nung novice ka, ikaw yung daldal ng daldal. Pero nung expert ka na class, ikaw na yung part na nagsosolve po ng problema natin. Sige? I will discuss the other components of that on the next discussion.